I've been there about 15 years. I'm a hospitalist PA. I take care of the inpatients. So if you're in the emergency room and you have to be admitted to the hospital, you'll see me and I'll take care of you throughout your hospital stay and discharge you when you're ready. I love my job. I love my job. Being in the medical field and knowing how important it is to make sure that we keep patients safe is #1 priority. January, February is when we started hearing about the pandemic, and then I remember the day that they closed churches and schools.
The fields are empty, the playground's deserted.
And that's when it really hit home for me, and I realized, okay, it's coming here, we gotta get ready. I was actually sent into a larger hospital to learn and train how to take care of potentially catastrophic situations. Many of us just had severe anxiety during the pandemic, thinking we were bringing this home to our families. There was a bunch of us that went to learn how to do mass casualty training in case we needed it. So that was a little scary, and that's kind of when it really hit home for me. The vaccine rollout went pretty smooth at our hospital. I've never experienced an emergency use vaccine or an emergency use, really, anything in my lifetime. I've been pro-vaccine. I mean, my kids are vaccinated. We rolled them out to pretty much like essential workers and that and all that first. There were many that were excited about it, and I understand we were all looking for a way out. After rolling them out then to the kind of general public, the elderly and in nursing homes in the area, we would get elderly in with COVID. It was kind of interesting. And it was weird. It was almost like a week after they would get their first dose, they would test positive for COVID. And then we started seeing patients coming in, I got my vaccination and a week later they're in with pneumonia. I can say for sure in 2021, this is the year of pneumonia. Independent of COVID, I've never seen people with so many pneumonia, sepsis. And even in the middle of summer, all summer, that's what we would get in the hospitals, pneumonia. After the vaccine rollout, I definitely noticed an uptick in heart attacks, strokes, blood clots, gastrointestinal bleeds, gastrointestinal complaints, appendicitis. We even saw pancreatitis, recurrent cancers. It was noticeably increased, where it wasn't just me noticing it, everybody seemed to notice it. It became clear to me that there was something wrong. I knew nothing of VAERS. The Vaccine Adverse Event Reporting System. I didn't know about our responsibility to report. It was never even talked about when these vaccines were rolled out. I mean, you'd hear it in the news here and there, but there was never this push to make sure providers were made aware that if you're getting patients in the hospital with issues, these issues, whatever, that here, you gotta go to this website and start reporting and start paying attention to stuff. That was never educated to us at all. And I went on the website, I looked, and the first thing I noticed was that it said healthcare providers are required by law to report certain adverse reactions to VAERS. And I said, what do you mean? Like, what law? So, and then you look further, and it had a whole section on it, exactly what you're supposed to report. Specific things you're supposed to report to VAERS after the COVID vaccine rollout. So that's when I started reporting patients on my own. Well, very quickly that became a full-time job in and of itself. I would say within 3 weeks to a month, I had already had 50 patients reported. And that was just of the providers that were willing to tell me about patients, recognized that there may be a problem. So I went back to my administration and I said, I need help. I can't do this all myself. It's overwhelming. I'm on the phone with the CDC all the time. I'm on the phone with these patients. I need more people to know about it so they can help me and we can do the right thing. But that was met with then resistance, because that's when the vaccines were really starting to get pushed. Everybody's got to get vaccinated. This is how it's going to go. And by me admitting that we need to report because there may be some issues, it would create vaccine hesitancy amongst the healthcare workers, amongst the staff, amongst the other staff, amongst the patients. Well, that's when things changed, because I wouldn't be quiet about it. And what I did was I put envelopes in our emergency room and told many of the providers, hey, if you get a patient that comes in and they just got their vaccine, or you think something might be related in any way, go ahead and put their demographics in the envelope, and then I'll take care of it and call the patient and get the report done. thinking it was only going to be a few reports a week. No, it turned into, like I said, a full-time job very quickly. When you roll out an emergency use product that you're going to mass release on the population, wouldn't you assure that you have safety mechanisms in place? The first thing you would do is assure that people were educated about side effects, what to report, who to report to. Before you did that, that should have been the first thing. Educate your healthcare providers who are going to see these people in the hospital. Well, then how come we didn't get educated as healthcare providers? Well, I was told we're supposed to educate ourselves. It's not their responsibility.
Why are we not wanting to report this?
I don't know that it's a matter of not wanting to report it. I think the position the system has taken is that each provider has a responsibility to report on their own patients.
But if the providers aren't provided education on what we're supposed to be reporting and the importance of such, how do they know to do it?
But I believe the providers should educate themselves when they're dealing with patients related to COVID vaccination.
They don't even realize that these are specifically the conditions that we're supposed to be reporting to theirs.
Yeah,
So and we've had a ton of them. I mean, we get thrombocytopenia, blood clots. Just Tuesday, I think it was, we shipped out, I think, 3 cardiomyopathies, blood clots. We got a guy on the floor, and well, he just died, I just pronounced him a second ago, who got his shot, and literally 2 weeks later, the guy ends up with cancer blown out of nowhere, a portal vein thrombus, like, just get stroked. I had a lady that had a stroke within 48 hours of her vaccine, fully on anticoagulation. I had a lady have a bilateral PE, and she was on Eliquis after her vaccination. I know these are things that are reportable.
That our hospital system talked to their risk management team, and I was no longer allowed to report on any other patient but patients of my own that I saw, where there was a warning that I was told I must support the vaccine effort and the approach to the vaccine. You know, during the pandemic, I received an excellence award for just my patient care and just how dedicated I am. And now I'm being looked at as a dangerous individual that's putting my patients in harm's way.
Come on, boys.
These patients deserve to be heard. These injured, I have to say potentially injured, because we don't know, right? But they deserve to have a voice. They're being shunned too. They're being told they're crazy, that they have anxiety, that it's not real. They don't have anybody fighting for them. There are injured patients out there. There are people whose lives are completely destroyed as a result of these vaccines. There are people who are now in the ground because of these vaccines. I have no doubt about it. And I'm speaking out because I want to be their voice. And I hope others come forward too, because I know I'm not alone. I know I'm not alone.
Well, I'm joined now by Deborah. First of all, I want to thank you for your courage. I know it's got to be really outside of your wheelhouse to come on to a news program and discuss, what's been happening inside of your hospital. I think it's important. We are, I want to tell you that there are nurses and doctors all over the nation that call us and give us reports exactly like this, but they're afraid to be in front of the camera because of what would happen. So I want to honor you for taking that risk, and thank you for being here today. All right.
Thank you.
All right. So to begin with, and I want to just sort of take us back through this a little bit. Prior to COVID and this pandemic, how would you have described yourself when it came to vaccination? Do you believe in vaccines? Where were you at with the concept of a vaccination?
Yeah, I believe in vaccines. I'm fully vaccinated myself for all the routine childhood vaccines, flu vaccine. My children are vaccinated. I really never questioned it up until now.
Okay. And at your hospital, one of the terms I've heard is a hospitalist, or, you're also a physician's assistant, correct? Do you hold any sort of, are you involved in any groups or leadership roles at the hospital?
Very much. I'm actually the advanced practice provider director for my hospital. I'm the lead PA for our hospitalist service. Yes, I'm very involved in leadership roles in the hospital, and I am somebody that's very respected in the hospital by the physicians, by the other staff, very much so.
So if there's a discussion and maybe a new way to treat or how we're going to transfer patients or anything that would be around, sort of getting the whole staff up to date on some new protocols or procedures, you might be involved in actually those smaller group meetings to take out to the staff. Is that correct?
Absolutely. I was actually involved in an opiate withdrawal policy that I helped to create for our hospital. So yes.
Okay. All right. So that's just so we understand where you're coming from. So then take me through, you believe in vaccines. Obviously, there's this pandemic rolling through. You're one of these frontline doctors that's in there, risking your life to, deal with these patients. What would you say, what was the sort of first, turn of events or thing that you saw that maybe even started creating a question for you?
Well, we rolled the vaccines out mostly for staff in December. And I myself was a little hesitant because of the quickness with which the vaccines kind of came to market. I was a little concerned about that. So I kind of just sat back and looked to see kind of what might happen. And about in February, I started noticing an influx of patients coming in with weird conditions. And at first I thought, this is just coincidence, just like everybody else. It's just coincidence. It's just, but it was odd enough that I kind of started to take notice. But then there was a specific patient that really kind of hit home for me. And I said, no, this isn't a coincidence. There's something very wrong here. Mm-hmm. And that's when I started to kind of look into things a little bit further and started to really get concerned.
What was the condition? I mean, not going to name the patient. Obviously, there's, HIPAA.
Correct.
They create a HIPAA violation, but in general, what types of issues were you seeing and what set it off?
This particular patient, had been vaccinated just less than 48 hours prior, and he died of like a multi-system inflammatory syndrome. He had acute kidney, injury and bilateral pneumonia and a heart attack and sepsis and died. And it was really quite shocking. So shocking that the providers taking care of him notified me of his case. I had nothing to do with this patient's case personally, but the providers themselves were very concerned about it. So they came to me and said, that this case needs to be looked at, needs to be reported. And at that point, I had already started doing some reporting.
Okay, so when it came to reporting, you said in the piece that you were unaware of VAERS. Like, exactly what does that mean? I mean, was you unaware that it was your job to use VAERS? Or are you saying you did not know the vaccine adverse events reporting system existed?
Both. I did not know anything about VAERS. That when the vaccines were rolled out, that was not something that, like we received education on. And you think we would have. I mean, you're rolling out an EUA product with no long-term safety data and very limited short-term safety data. You're rolling it out on the mass population and people who had prior COVID. Wouldn't you want to make sure that people were aware of what to do if you get a patient in the hospital, in the clinic, in the ER, in urgent care with some complaint after the vaccine? Wouldn't you first put a system in place and say, or add some sort of email in place to educate your providers, this is what you need to do? Because as adult providers, we don't really see vaccine injury as a rule unless somebody comes in after their flu vaccine with, say, Guillain-Barré or Bell's palsy. Those are things, we are well aware, and it's on the table of reportable events. But for
even there, you wouldn't report that to VAERS in those cases over the last 17 years?
I imagine somebody would. It's not something you see that often,
Okay.
in the hospital. Bell's palsy might be something you may see in the clinic, you may see in the ER, and it's not something that would necessarily be admitted.
Okay.
So we wouldn't know about it.
Right. Well, I think, because we've covered vaccine injury as over the years, and before COVID, so many parents with injuries to their children. And I think that it's shocking to hear that, someone that is not just like, you're not just a nurse or someone that shows up, or you're very engaged with your hospital over 17 years. You're in a fairly high level position where whenever there's a protocol in the hospital, you help sort of lay that out. Yet even you were unaware of VAERS for the 17 years that you were there, and it's been there the whole time since the 1980s. Just that right there. Should I be surprised? Should I be surprised or not surprised? Are you surprised that the only way, when we hear that vaccines are safe and effective, even before COVID, when we hear that vaccines are safe and effective, that children do great with it, we're all under the impression that what these reports we're seeing, 400 deaths every single year in the United States of America from this VAERS system, that, you know, at least the system's being used and you were unaware of it. Do you think that that would, if I was to sort of pull most of the doctors and nurses in your hospital prior to COVID, would they have been aware of VAERS?
No.
No.
Unless maybe if they were pediatricians, they would be aware of VAERS, because you would see that in the pediatric population.
Right.
But for adult providers, for, you know, unless it's a pediatric hospital or pediatric clinic or a family medicine clinic where you see kids, no, that isn't. And even there, nobody knows about VAERS.
And if you
it's really, I shouldn't say nobody. Very few providers know about VAERS.
Okay, but I think even we also have to be honest that your pediatrician is not where you're going if your child's having seizures. You're
Correct.
going to the ER. You're going to a regular hospital. You're not going to your pediatrician's office.
Correct.
So if they're the only ones that know about it, we're going to have a problem here. All right, I don't want to like dwell in the past. Let's get to where we're at. I'm just sort of trying to understand the culture of what we're talking about. When you finally, how did you find out about VAERS?
I went online and started looking up about these vaccines, and VAERS was part of looking up the vaccines. I started seeing, you know, websites about VAERS, and I'm like, oh, what's this VAERS? I'm going to go on it, and then I started reading about it, and then I saw the clip that said, you know, healthcare workers are required to report to VAERS by law, and that really hit me hard because I'm like, I'm a healthcare worker, and I'm required by law. Whoa. I haven't been doing this, and that really concerned me. Mm-hmm. And I said, my colleagues haven't been doing this. What does this mean?
And so then you start doing this report. So now I want to be clear, because the language, a lot of people, you know, there's conversations, I know that you've had them in your hospital of, you know, is it over-reporting? Is it under-reporting? How do you know it's a vaccine injury? But to be clear, the language is very clear on VAERS. It tells you it is not your job to determine whether this is induced by the vaccine, but simply if it happens within this timeline, you submit it and we will do the work to, you know, pull it out or put it in, correct?
Correct. Correct.
Okay. And so I also want to ask you another question, because this is huge. And this is an argument, frankly, that's in just, you know, in the civilian population now, which is when you say, well, you do realize there's like 14,000 reports of deaths now in America. And I'm shocked to find like your average, you know, person now is saying things like, well, VAERS is unreliable because it's you know, it's just reported by anybody. It can be anybody at home reporting to it. You know, they don't really do anything to verify it, and so it's unreliable. And what would you say from your perspective? Is it unreliable? Is it just something that it just gets thrown up there and there's no due diligence to make sure it's a good report?
No, it is a full-time job. Reporting to VAERS is a very involved process. And I give kudos to the VAERS people, the individuals who work for them, because they really do try to get the information. But because of that, it really is a very involved process. And I completely disagree that anybody can report to VAERS. But I believe there's very few patients who themselves report, because they require so much data that a patient wouldn't know.
Okay, like
and
what?
So they ask questions about blood work, about your individual story, like what exactly happened to you. Did you recover? The dates of the vaccine, the lot number of the vaccines, your allergies, your medications, if you've been in the hospital previously, if you've had a reaction, like all kinds of questions. And I would think most patients would go to their provider to ask them to report, because it even asks who is the best medical provider to contact about this case.
Yeah.
After reporting, many times I get constant calls and emails from VAERS every week wanting to discuss these patients.
So they actually follow up. They don't
very
just
much
doesn't just go into it like we just throw it right up on the board.
No.
They call about each case, ask you details.
Yes.
that may not have been filled in, or for more information.
Yep. After you submit the report, you get an immediate E number, which is basically a temporary number. Then VAERS kind of looks further into the case.
Okay.
And many times they request medical records, or they call the provider and they want to discuss the case, and you discuss it with a physician or a PA who works for VAERS. And then once they gather all that data, they'll give you a permanent VAERS number with which you can give to the patient. So it's a very involved process, and they really do try to get the full story. And that permanent number is a validation of your claim. It's been looked at, it's been validated, here's your permanent number. Okay. It's not this wishy-washy system that they're making it out to be. It should be respected, and we've used it for many years. Why all of a sudden is it considered, it was considered fine before, now all of a sudden it's a wishy-washy system. It's kind of crazy.
Well, it happens to be the only one.
It is the only one
designed by the CDC that runs our entire, health system in America. So if you have a problem with it, you should complain to CDC, and especially since it's the capture system that we are all being forced to use when you made an emergency use authorization and turned our entire population to a test group. I'm amazed. It amazes me that we find ourselves today, right now, with Joe Biden threatening to fine employers that have no business dealing with medicine or health, fine employers that don't force this vaccine upon, their employees. Yet, wouldn't it have been smarter, not only do you have a mandate, but how about a fine on doctors and nurses that don't report? Because we needed such a robust and accurate count of what was happening, since too many people were getting it to really be able to figure out the numbers. Then we need all of that data. And yet the opposite seems to be true. So when you said, I'm going to start using VAERS then, right? I'm going to start doing my due diligence because I am seeing a lot of anomalies. You thought, well, I would imagine, just like I would if I'm in a business, it's like, hey, did you know we're supposed to do this? Did you start asking doctors and nurses around you if they knew that there was like a legal, like sort of an obligation, a law to fill out these VAERS reports?
Yes, very much. And I actually went to my leadership and talked about it. And I said, is anybody aware of this? Like, we need to start doing this.
Yeah. And
of course, because it is such an involved process, nobody really wants to do it. We don't have the time. There's no time in your day to do it. They kind of came back at me and said, you know what, Deb, if you want to take this on, that's okay. Go ahead and start reporting to VAERS. And here I'm thinking I'm just taking on a couple of patients here and there.
So meaning, like, I'll give you some of the cases I think are like vaccine injury. I don't have time for it, but if you
exactly,
really do it,
I kind of volunteered to do this job because I felt it was just a
tiny side job.
Yeah, because it's important, right? I recognize the importance of it right away. Like, we need to do this. And so what I did was I put envelopes in our emergency room, in our fast track, because that's kind of where you're going to see these patients first. And I told the providers, hey, put any patients you think may have something to do with it, or you're not sure, just put them in there. I'll review the cases and I'll start reporting. And I did the same thing to many of my colleagues that I work with. Okay. Not all of my colleagues agreed with me because they really didn't want to even believe that these vaccines could even potentially cause any problems.
Right.
Plus, we didn't even know what problems we're supposed to be looking for.
Right.
So I had a lot of my colleagues not really give me reports, but a lot that did. But like I said, this volunteer position turned into my entire week off. That's all I was doing.
Wow.
And it's a long process.
So when you say long process, there's a lot of doctors that have reached out to us. We've talked a lot about VAERS. They're like, look, because of you, or, because of this situation, I'm looking to VAERS. And I've had many of them say the same thing, but you don't understand, like, to fill out a VAERS report, especially one of my friends is an ER doctor. And he says, in the ER, you're in, you're out, right? Like, you never know when you have time. I would sit down to write a VAERS report. It's really in depth. And at first, they wanted lot numbers. Like, well, they're not even my patient. I don't know what lot they use. I didn't give them the vaccine, but I'm having this issue right now, and it should be reported. So then I got to go find the lot number, and, but all of this, and that you start figuring it out. But they said, literally, if you get called, you get called, we need you, out on the floor, and you run out, this system doesn't stay where it's at. It just, once it shuts off, you're logged out, and now you got to start all over again, which just seems like for all the computer systems in the world, and by the way, if you're out there, Google or Microsoft or whoever builds this thing, you want to do these doctors a favor and set up a system where they can sort of save. Here's a concept. How about you save it as you go along so that you don't have to start over? These people are busy. They're trying to save lives, but that's the problem, right?
Correct. And one of the other things that happened to me numerous times is you get through the entire report and you click submit, and then it says authentication failed, and the whole report's gone, and you have to start all over again.
Oh, man.
So what I was doing was saving some of it in a Word document because I knew that potentially could happen, and so I could just cut and paste. Because it's just, yeah, it was very, very glitchy in the beginning. It was really, oh gosh, I can't tell you how many patients that happened to, and I would sit at home and just, oh.
So now, what types of things were you seeing? Let's just talk about some of the issues. One of the things I found surprising, and that we are hearing a lot about, and it's really weird. I've actually talked to oncologists, one, that I know very well, and others have mentioned this, that my cases, like they all talk about how they know there are cases that are in remission, and they know the remission rates and how often, how long those hold and how long they last and what's going on. And I've talked to several oncologists, like, I don't know what is going on, but so many of my patients that are in remission are just, their cancer's coming back like overnight. And one of the doctors I was talking to said, and I just started finally asking, wait a minute, did you get the vaccination? And now they're starting to ask, did you get the vaccination? Because it's throwing all their numbers off. It's making them look bad, right? I mean, all these cases popping up. So one of the things that I noticed you said you saw sort of a rise in cancer patients.
Yes.
What was it that triggered that? Like how bad? I mean, bad enough you could tell?
Very much so. Actually, one of the early patients that I reported on was somebody whose cancer came back from remission and rapidly killed the individual. I mean, it was kind of crazy. I don't know, the cancer was in remission, going about your life, and then all of a sudden, wham, it's back, and it's back with a vengeance, to the point they couldn't get the patient on treatment quick enough, and it killed the patient. And that's happened quite a few times.
Really?
Very noticeable. And not just myself, but even by our oncology colleagues. I actually called one of our oncologists about this particular patient, and he agreed, wow, this could really be possibly related. And it was very early in the VAERS reporting and very early in this recognition. And since that time, that's unfortunately a very common thing we see. We're also seeing new cancers come out of nowhere, very weird things. Again, that solid organ tumors that we can't get biopsied before they kill the patient.
Wow.
I mean, they just progress so rapidly, you can't even get these patients a biopsy to find out what kind of cancer it was. So the families are left with either an autopsy to determine what cancer it was, or just unknown.
Wow.
Yeah.
What other things? What about thrombocytopenia? This is something that we heard a lot about with the and AstraZeneca first in Europe, and then Johnson & Johnson here. We looked it up. We've discussed on our show. We're seeing Pfizer and Moderna seem to have the same problem. Blood clots, thrombocytopenia. Have you seen any of that?
Very much so. Very much so. Heart attacks, cardiomyopathies, thrombocytopenias, strokes are big ones. Blood clots. Interestingly enough, 2021 is the year that our blood thinners no longer work.
Wow.
It's amazing. We've had quite a few patients that have developed pulmonary emboli as well as blood clots in the legs on full anticoagulation, full blood thinners. And we just look at ourselves like, well, and I actually had a colleague tell me the other day, well, drugs are not 100%. And I'm like, it's interesting because in 2021, a lot of our drugs don't seem to be 100% anymore. It's kind of interesting. And we're seeing some Bell's palsy. I did report a couple of cases of Bell's palsy, a lot of odd neurologic complaints, seizures, people with these weird tremors. It's like they can't control their body. I had a patient recently with that similar complaint. A lot of falls, GI complaints, gastrointestinal complaints, brain bleeds. One of the things we saw early on was elderly people passing out after the vaccine. So they would get their second dose and then go home. They're feeling fine. And then the family would find them on the floor the next day, passed out, hit their head. And to the point where I said, geez, maybe we should be telling people at these vaccine centers, if you got an elderly patient, stay with them that night, because you might find them on the floor the next day.
Wow.
So yeah, we were seeing a lot of that, a lot of pneumonias. That's another one, sepsis.
In the middle of the summer, you said.
Yes.
I mean, which is weird, right? I mean, the
It's
summer,
weird.
you're not getting the flu, you're not getting
No.
colds, you should be doing the best you're going to do all year, and yet you're saying pneumonia everywhere.
Oh, yes. And keeping in mind that, in the spring, early summer, we were out of the masks.
Right.
Where I live, we were free. We thought this was over, and yet we're getting inundated in the hospital with people with pneumonia. And we're saying, geez, you're outside. It was a beautiful summer. You're getting fresh air. You're not in these masks. This is very odd. It's very odd.
So you start reporting all these, and there's a phone call we have now. Was it with the U.S. State Department?
New York State Department of Health.
New York State Department. Okay. Let's go ahead and listen to this, and then I'm going to ask you a few questions.
Talk about New York State numbers and that the vaccine is safe and effective. How do we know that? Because if no cases are being reported to you guys of fully vaccinated patients who are coming in with COVID, then how can we make that claim? Because I can tell you, we just lost a guy the other day to COVID pneumonia. He died, and he was fully vaccinated in March and came in with severe COVID pneumonia and died in our ICU. So, I mean, that wasn't reported to you guys. So how can you claim as a state that they're safe and effective when hospitals are seeing this and you guys aren't made aware? Because there's no mandate to be made aware.
Right. It's not a state claim, though. That's also something that's federal, but I understand what you're saying. But that's why it is important. We do want we want all the providers to be able to report this, even if it's not mandated. We do want to, because that's the only way that, like you said, this will be able to be found out.
But there is no education. Like I said, it's the only education we're receiving is how we're supposed to be pushing the vaccine. But there's no education about what to do when a patient has a problem.
Deb, I feel you, and I really do appreciate your work, and I hope you continue doing it. Because even though it's not something that I could say at this moment that I know for sure that it's mandated, because that's what I'm being told, that it's not, at least not in the way that unless they're an actual vaccination provider that was giving out vaccine. The enforcement is not there.
So why were you reaching out? To try and say, why are you not getting more doctors and nurses to fill these things out?
Right. I had actually first written a couple of emails to the FDA because this is all new to me. I didn't know what I was supposed to be doing, but I knew what was happening was wrong and needed to be heard and told.
Right.
Because my duty is always to my patient and doing the right thing. So I wrote a couple of emails to the FDA alerting them of what was going on, thinking that they were going to get back to me and we're going to have some solution to this problem. And I heard nothing back. So then again, I then reached out to the State Department of Health and said, hey, can you guys help me out? Can you help me understand what's going on here and who am I supposed to be reporting to? And like I said, they really weren't terribly helpful either.
And it's weird because it's like she's repeating what you're saying, but doesn't really want to do anything. But like, yeah, no, you're right. I know we're, really it should be done. We're not going to know how many injuries there are if people like you don't do it. And you're like, but why then aren't you having a program to teach us to do it? Like, right? It makes perfect sense. You saw a need, right? I mean, that's what a good employee does. You see a need. We have a problem in this hospital, doctors and nurses. And I'm assuming then you reach out to the State Department thinking this must be happening in every hospital, because if they're like me, I didn't know about VAERS. And so we're telling people the vaccine is safe and effective, but how will we come to that determination if nobody's reporting the injuries that are actually happening?
Correct.
What did you feel like when you would get done with a phone call like that? I'm sure you're having many. Like, did you start thinking, do they just not care? Are they stupid? I mean, what runs through your head?
I was frankly just floored. I couldn't understand why, again, if you're going to release an emergency use product that we don't have any really long-term, short-term safety data on an entire population of people that were not represented in the clinical trials, why wouldn't you assure that safety reporting was done, that the people who would be potentially seeing injuries would be educated? Hey, we're rolling out these vaccines. You might be seeing something. These are some of the conditions we might see. Make sure this is what you do. This is what you do. You report to VAERS. Wouldn't you want that? So it was mind-boggling to me. I mean, it's funny. I tell one of my colleagues all the time, an average day, I think I'm crazy. I'm going crazy. Because I'm like, why doesn't anybody else see this? Why is it so difficult? It just seems like it's just the right thing to do. We're healthcare providers. Our first duty is to do no harm and to assure safety for our patients and our communities. That's what we do.
So you start filling out your own, and you're filling out those from people that are just like, I'm too busy, or I don't want to deal with it, I don't want to figure it out, so could you just fill them out? So then so as you said, you took up a whole week trying to fill those out. Did anybody tell you, like, was there anyone on staff that said, as your friend, I'm not sure that this is a good idea, like this might get you in trouble? Were you under the impression this hospital is going to support this work?
Yeah, I never thought in a million years that anybody would be against this idea. Because again, I have this belief that, we're all healthcare workers and we have a common goal of doing the right thing and keeping our patients safe, because that's what's grilled in us every day. We have this safety meeting every day at work about keeping the patients and the staff and the community safe. So I never in a million years thought that it would be looked at in any negative light. And I didn't really get any really pushback from any of my colleagues, so to speak. It wasn't from them.
What was that environment like? I mean, as you're having lunch for things, it must be a conversation that you thought was interesting. Was everybody engaging in the conversation?
No. There were many that kind of laughed at me and said, "Oh, you're being too emotional about this. Deb, you always care too much. You're looking too much into this. Why are you wasting your time?" And I'm like, because it's the right thing to do, guys. So I had a few that really, kind of shook me off and said that, I was just being ridiculous about it. But I had quite a few that supported this, and they were like, no.
Makes sense.
But again, they know me. That's kind of person I am. I tend to be the one that's very kind of outspoken in my hospital when I see things that need maybe to be looked into or something that I get passionate about, because that's my role as a leader.
So as a leader, then obviously you thought, well, I would normally be involved. I'm in, committees all the time. I put out protocols. So you decided to sort of reach out to the whole staff in the hospital in an email and just let them know what you were doing, and what issues did you sort of address in that email to everyone in the hospital?
So the original email, are we talking about the original email that I sent out? And I basically told my administrative leaders, people above me, this is what I'm going to be doing.
Right, we have it here. We wanted to address concerns surrounding the Johnson & Johnson vaccine and being associated. I can't read that. This is thrombocytopenia. You're discussing sort of thrombocytopenia as an issue that you're seeing, which is reduced platelets, right? The platelets sort of drop to the floor. So what was it we were saying in that email?
There was an email sent to us kind of globally to the medical staff about a syndrome called VITT, V-I-T-T. And it was, if I remember, it was at the bottom of an email. And I kind of saw it and I said, well, geez, I don't really understand what they're trying to say, because it wasn't very detailed. So I went and looked it up, and I found a journal article talking about it and kind of gave a protocol of how you're supposed to approach these patients when they come into the hospital. So I sent kind of a rebuttal email to those people involved to kind of let them know, I'm going to just elaborate on this further, because if you do the wrong thing, you could potentially harm the patient. So I added additional things we really should be looking at based on this journal article I looked at. And that's kind of when things turned for
so
different, I guess.
You're trying to warn your hospital. And I'm going to assume, like, one of the things I know was a big issue, and there's this turning point for people that got it, thrombocytopenia, drop in platelets. But a lot of times, and what was so interesting and rare with the vaccine injury compared to what we see in nature was you're getting blood clots and thrombocytopenia at the same time. Blood clots usually caused by too many platelets, or platelets coming together, creating blood clots. So you give drugs to thin that out, right? To drop the platelets in order to get rid of the blood clots. But in this circumstance, I'm sure people died because there was sort of this alarm that went off. You can't give heparin. You can't give, a blood thinner because they're already having issues with not having enough platelets. So is that a part of what you were trying to say?
Right.
You could kill somebody if you're not aware of this issue.
Right, and there's a blood test that you're supposed to order kind of immediately if you suspect the syndrome based on these criteria. So that's all I was trying to do, is just kind of elaborate a little bit further on that that original email, just to, because again, this could be very detrimental to a patient if we miss this. And this is something that obviously they're seeing around the world, that they wrote an article about it. I think it was in the Journal of Cardiology, or one of the cardiology journals. So I said, geez, if they're seeing it across the country, this is something I think we really need to talk about maybe a little bit further, so we're all educated on what we should be seeing.
But it's a vaccine injury. I mean, you're discussing something that happens from vaccine injury. You're talking to the entire staff about it, so they're looking out for it. Your people above you were not very happy about that.
Right. Because they said that I should have kind of directed that email to my direct leader, and let that person.
We actually have this conversation. So, folks, here is the actual phone call that took place. We've all been in those moments where the boss is not happy with what's happened. In this case, I want you to think about what's being discussed. She's trying to save people's lives, and the hospital doesn't want to have any part of that. Listen to this.
I know you had sent out an email to some folks this morning, and so I wanted to make sure we had an opportunity to talk about this sooner versus later. So, listen, Deb, I know I absolutely understand your concerns about the vaccine, and I absolutely believe that your heart is in the right place with wanting to make sure that we are doing our due diligence in reporting the adverse events. Mm-hmm. That said, the email that went out this morning really needed to be discussed, but I think that we really need to make sure that we're providing a consistent message to our team, and we need to make sure that that's also in alignment with what our health system is asking us to do. There's a risk to the organization from a perspective of both underreporting and overreporting. So how do we make sure that we're sending the right message out to our providers, and that they have the information that they need to be doing this correctly? Because I share your belief that it's important that we get these reports in, but I think we have to be thinking a little bit more about the process and what's sort of expected here. From what our risk team is telling us is that really you can only be reporting on the patients that you are providing direct care for. And so you cannot, and I know you've been, volunteering and trying to be helpful, but we need you to kind of dial it back and focus on the patients that you are directly responsible for. And then if folks do reach out to you, because you've been saying, hey, reach out to me, they need to be directed to VAERS, and they need to do the process themselves for the patients that they think need a report on. Okay, and so
I have been telling them to do it, and they don't do it. The reason I took this on is because nobody else wants this response. I mean, it's brutal, because you then will be getting phone calls from the CDC every single day as a result. And the FDA, really is the problem here, because they did not advise hospital systems what we're supposed to be doing.
The approach has been that this is the responsibility of the individual provider who believes that they have identified, a potential adverse event. This is frustrating, but you can't control whether or not someone else is going to put the report in. You can control what you do for your patients, and then I think if you're concerned that folks are not reporting on their patients, you're welcome to put in a Safe Connect. You're welcome to talk to Pete or myself, and we can, kind of address those with providers.
But like I said, I brought this up back in February, and I see no response. I mean, that's my frustration, is this, we are not doing these patients a service. And again, the FDA, they did not tell us, and they still will not tell me, what conditions are we supposed to be reporting? They are vague. They don't know, because they never got the clinical trials. They never did them. We are the clinical trial. Let's face it.
I don't want us to go down any kind of rabbit hole here, but I think the thing we have to be clear about, and I think, and I'm just going to be frank with you because that's the only way I know how to be, Deb. But I will tell you, in reading, the few emails that you've sent me, and then in reading the email that went out to the provider, it does come across a bit very vaccine. I say very, but it comes out quite almost anti-vaccine, right? And clearly as an organization, as a health system, right? And as someone who as an organization that's working on following CDC guidelines and following the guidance of the Department of Health, we are very much advocating for patients to receive the vaccine, and we're very much working on there's tons of efforts out there to try to reduce vaccine hesitancy. I have some concerns, Deb, that the tone that you have with this a little bit is certainly being felt on the floor, right, and being felt by your colleagues. We need to be a little bit careful about that, right? I support your mission and goal of wanting to make sure that we are following the law and that we are reporting adverse events. But I also want to make sure that as a leader in the organization and as a provider within the organization, that you understand we want people to get the vaccine. Right? We want people to understand that on the whole, this is a very safe vaccine, right? And that the science supports that.
I appreciate it, I do, but I can't understand why, as a whole, in the world, people are acting like everything is grand. It's not. It's clearly not.
I think we may have to agree to disagree on sort of what's happening, kind of globally with the vaccine. I do think that we're seeing, yes, just like other vaccines, there are folks who are going to have it be negatively impacted, but certainly on the whole, we've seen, a tremendous benefit to the vaccine. You and I are not individual providers. We're employed providers. We toe the company line. That's part of our responsibility is to be, is to be supporting the mission of the missions of the organization.
And so even when we're getting COVID-19 patients who are positive and fully vaccinated in the hospital, we're going to leave it up to the individual provider to report, because I'm telling you, they're not reporting. That should be reported every time, and it's not. I can tell you, I know patients because I only reported them because the provider didn't. I have yet to see one double-blinded, randomized, controlled clinical trial that shows that these vaccines are going to be effective long-term after 6 months, whatever. We don't know that. And if we're not reporting hospitalized patients who are coming in fully vaccinated with COVID, that's an atrocity. I mean, it's an absolute atrocity.
What we do see, though, and I know it's an FDA-approved thing, but we see people with the pneumovax come in with pneumonia all the time, people with the flu shot come in with the flu all the time, just because the vaccines, whether they're COVID or they're flu or the pneumovax, they're not perfect vaccines.
Oh, I agree. We have no long-term studies. Right now, the CDC is saying that these vaccines are only effective for 6 months. I mean, but yet we're telling people take off your masks and run around if you're vaccinated, but at the same time, the CDC is saying you're not. So, I mean, it's crazy. It's just crazy.
And this is new for all of us. This is, certainly a different thing than we've seen. Just to be sort of clear, again, I absolutely support your work on making sure that you're reporting these events. You cannot report for other folks, and so just direct them to report on their own. You're a leader, and your voice carries a lot of weight with the team. And it seems to be very widely known that you're extremely skeptical of this vaccine. You have every right to your personal beliefs and your personal opinions, Deb, but we just need to be careful as providers and leaders that we are also trying to be consistent with the mission and the message of the organization.
From now on, if somebody comes up to me, I'm just going to tell them, look, you got to do your own research. I don't know.
Or talk to their medical doctor. I mean, if they're asking for themselves, tell them to talk to their provider, right? I would just be a little bit careful about that, Deb, okay?
Whenever you take a new medicine or even, obviously a vaccine, it's a risk-benefit decision. It's a little bit unknown, but at the same time, the CDC and the Department of Health are recommending it for everybody. I think that letting people know, yes, there's risk, but yes, there's benefits. And currently, the national sort of people are pushing to have these things done. And then, you can say, you look at your own research or things like that, but I just want to be careful that we don't discourage people in a time where we're really trying to get the population vaccinated and get this disease under control.
I'm mad at our governing organization in this country because I do not feel that they prepared us providers with this rollout for what we are supposed to be doing. We have no guidance. We have no answers. And when I try to call the drug companies for answers, they give me the same song and dance about how, everything's under experimental use and we don't have any answers and we can't advise you. I wouldn't buy a damn, dryer from a company like that who won't stand behind their product. I mean, it's unbelievable.
Well, a couple of statements I want to make before we continue. First of all, that came from about a 25-minute recording. That was about 8 minutes of that. I like to, I know other news programs, you would probably just get 30 seconds that we'd all move on. I think it's really important that we sort of hear the culture of what's going on. It's clear in that conversation. There's one of three people that care about the interests of the patients the way we would want them to, we expect them to, and others that are saying things like, you've got to toe the company line. It really is what the health system wants, not what we want to do. I mean, these types of the discussions happening. I also want to make it clear because so many of you out there are whistleblowers. Many of you are already talking to us, but if you're interested in being a whistleblower, all you have to do is go to whistleblower@thehighwire.com. Send us an email. It's totally private. I'm sorry, whistleblower@icandecide.org. Whistleblower@icandecide.org. We will begin a private conversation with you. As I've said, we've had many of those conversations going. Very few decide to come in front of the camera, and we will never discuss that until you do. I also want to make it clear that if you are one of these people that is inside of a hospital system, that phone call was recorded in New York, right? Correct?
Correct.
Which is a one-party state. What that means is it's legal to record a phone call without the other party knowing. You may not live in a one-party state. If you live in a two-party state where both sides need to know they're being recorded, we would never want you to break the law. So be very careful before you decide to do what Deb did here. Make sure that you know the laws of your state and that it's legal for you to record or videotape the conversations that you are having. And then once you have those, though, and you've done it legally, please reach out to us and we will discuss what you can do with those. Okay, so with all of that being said, I want to get back to this incredible conversation. Clearly, they're upset with you. You sent out an email saying we should be very aware of this thrombocytopenia. We could kill people. This is very important. But they're like, you really should have talked to us first. And like I said, when she's saying we need a consistent message, and we're really trying to promote the vaccine, we don't want vaccine hesitancy. We're trying to get over that. And you're kind of starting to sound like you're anti-vaccine, and we can't have that. Was that the response? When that phone call, when you got, I'm sure like you get the call, we'd like to have a conversation with you. Did you think this was coming?
I knew that after I sent out that, actually, I shouldn't say that. When I sent out that email, again, I thought I was doing the right thing. Like I'm like, these are people I've worked with for a very long time. They respect me highly. I really didn't think I would get that response. And then I did. Like, that's when everything kind of changed. And,
Yeah.
and I was like, I don't understand. I just don't understand.
Right.
Why. It's about the patient. That's what this is about. That's our job.
It's
about the
amazing. You
patient.
keep hearing these statements that, the science tells us it's safe and effective. And you're sitting here thinking, I don't trust the science anymore because we're the ones that are supposed to be reporting this. And you're literally being told, stop reporting for anyone else in the hospital. No one else is. So you're going to represent, what, one out of how many doctors that's reporting in your hospital?
There's quite a few.
How many?
There's quite a few. I mean, if you think about the ER doctors, the hospitalist doctors, even the surgeons would see some cases. I mean, maybe 20 doctors, but then there's PAs too,
Right.
that are seeing things or could be seeing things that would be reporting.
So 1 out of 20.
I mean, the clinics
let's say,
too,
1
the
out of 20.
outpatient clinics.
So we're just going to try and take some math out of what's happening in this one hospital. We're seeing about 1 out of 20 of the amount of cases that could be being seen in this hospital. And so far, how many cases do you think you sort of reported to VAERS?
I kind of lost track at 120. I have quite a few still that I need to report, and it's just such a daunting task. I've been so busy. It's really hard to do. And again, keeping in mind, again, the far majority of those are now only my patients. And again, they're not all at all. And I know it doesn't sound like a lot, but I'm in a small hospital system.
And so not only this phone call, we've got some emails that they sent to you. They're a little bit annoyed. Let's take a look at 1 or 2 of these emails. Per our discussion, moving forward, you will only report, they obviously want to get this through to you. They want to make sure you heard, only report adverse events you encounter on your patients. If another provider sends you patient information, requests you to file a report, you will advise them they need to complete the report with VAERS themselves. Additionally, in your clinical role and as a leader in the organization, you will support the approach to the vaccine, which is following CDC and WHO. I'm assuming someone's name is there. We're going to black that out to protect them. As mentioned, I will be meeting with System Incidents Command leaders specifically to discuss the blank approach to VAERS reporting. Currently, VAERS reporting is the responsibility of the provider caring for the patient. So they are clear that you were not supposed to be doing anything. If anyone comes to you, you now have to say, now, what happened when those people that were bringing you reports and you said to them, look, you really now need to report this yourself? How did that conversation go? Do you think they took that on?
No, because it's such an unbelievable task. They just can't. So then what happened was a nurse in the organization started collecting patients that she thought would be patients that needed to be reported and would put them kind of in my drawer. And then I was supposed to put them in that Safe Connect system. But again, who's going to pay me? Like, this is going to take an unbelievable amount of time. And I even had a conversation kind of with my leadership talking about that and that, we put these in the system, but where do they go? Who follows up on them? Right. Then how do I know that these patients got reported? Because some of them, again, they directed me not to report on patients that weren't mine. But before that happened, I had talked to some families about their loved ones' cases being reported, and they're waiting for their report. They're waiting for their case numbers, and they're not going to get them. And, right. Because I was kind of halted from doing that. So, to put these patients in this system is, again, a very involved process. And who has time to do right. that?
I guess it would only matter if we cared about the safety of humanity right now and the future of our species. When, earlier on in the show, and you've been here sort of sitting and watching it, there's this discussion going on, the epidemic of the unvaccinated are filling the hospitals. You only have the view of your hospital, but is that your experience, that it's mostly unvaccinated people that are coming into the hospital, or is there, at least some that are vaccinated that are either suffering from COVID, but as you're saying, and that's what I thought was interesting, that phone call, right? He's like, well, we know flu shot, people come in with the flu after it. We know pneumonia shot, they come in with pneumonia after it. But that really wasn't a lot of what you're reporting. You weren't reporting breakthrough cases. You were reporting heart problems, strokes, shaking, seizures. I mean, that's different. You're not, it's one thing to report breakthrough cases, but these people are really messed up, right?
Right, and we know the efficacy of the flu and the pneumonia vaccine. We know the efficacy because they went through the full testing and everything. So we know. With these, we don't know the efficacy, which is why that's not a good comparison, because we don't have that data. That's the whole reason we are reporting this stuff, so
So from an inside look, inside of a hospital, what percentage of cases coming in, to ICU, into the ER, these things are unvaccinated compared to vaccinated?
So that is something I've actually been kind of tracking for a couple of months.
Okay.
And specifically in July, I had a particular day where we had 35 patients on our inpatient hospital census just for our group, and 30 of them were fully vaccinated. And out of those, all seven patients in the ICU were fully vaccinated, and 9 of the patients So 9 of those patients were listed initially as unvaccinated, but I went back and checked and talked to the patient, and they actually were vaccinated, so I updated the system.
Wait a minute, explain that to me. So how are they coming in on why is that discrepancy taking place?
Because on admission, there is no requirement to ask about the vaccine.
Okay.
So, and our system is set up that if you're fully vaccinated in our health system somewhere, one of our clinics, or somebody has put it in one of our outpatient clinics, it'll automatically kind of be put into the electronic health record.
Okay.
But if you're vaccinated, say at some CVS pharmacy or something outside of the system, that's not going to be automatically put in that system unless you ask.
Okay.
So it'll list you as unvaccinated in the system.
Interesting.
So you have to, again, it's not a question on admission that is asked, even if,
Which is crazy.
Yeah,
in
it's
the
not
middle
asked.
of an emergency use authorization
Right.
situation.
So what I would do is then I would ask my colleagues who had those patients, hey, ask them if they're vaccinated, or the nurse, ask them if they're vaccinated. And then if they are, we'd get their information and we'd update the system.
Right.
And so I updated the system for that day.
7 of 9?
9 of those 35 patients were
Okay.
listed as unvaccinated, and they
Okay,
actually were.
Wow.
So then I updated the system and found out there were 30 out of 35 patients that day in the hospital fully vaccinated. And at that point, our county vaccination rate was about 45, 46%. And yet, who's in the hospital sick? And I did bring this up, and I was told, well, it's a lot of them are elderly and things like that, and they're more likely to be vaccinated, and that there's a lot of things that could affect those numbers. But it's still odd, right? Every patient in the ICU that day was fully vaccinated.
It is odd.
Where are our sick, unvaccinated people? I mean,
Especially
we
if
do
that's
get them, don't get me wrong, but
We're not
compared,
overflowing because of that.
right,
We
compared
clearly
to our
see.
vaccinated patients, they're in there and they're sick. And I'm not saying just from COVID, I'm talking about all these other weird conditions. And many of these vaccinated people are actually on their 3rd, 4th, 5th admissions after the vaccine. I actually spoke with a VAERS representative the other day about this, because I said to her, I said, I've got a lady I'm reporting, she called me about, and I said, she's back in the hospital again. This will be her 5th update to VAERS. And I told her it's a daunting task, because every time they get readmitted and they have a case number, you're supposed to update VAERS and let them know, hey, they're back in the hospital with a new condition.
Wow.
Yeah,
There's nurses and doctors protesting, taking to the streets now all across this nation because of vaccine mandates in their hospitals. And I've said on this show, I can only guess. I'm not working in a hospital, but I worked for the Doctors Television Show.
Mm-hmm.
I've worked with doctors and nurses I won an Emmy Award doing that work for 6 years for CBS. I've never met nurses and doctors that don't believe in vaccines or don't sort of get the vaccine if they're told to get the vaccine. This is this crazy anomaly taking place. And I can only assume that for a group of people that normally just sort of believe in vaccinations to be walking away from their jobs the way they are, they've obviously seen some of the things that you've seen. They've seen something that's scaring them and making them really nervous about the vaccine. So under these circumstances, you're in New York, I got to believe the pressure's on. After what you've seen, are you going to get this vaccine?
absolutely not. I'm terrified.
Really?
I am more afraid of this vaccine than I am of COVID.
Okay. How is that working out with your hospital?
Well, my last day is going to be the 27th of September. I will be let go from my position.
Just because you won't get the vaccination?
Correct. And as I understand it, it's supposed to be a voluntary termination. I'm not volunteering to leave. I love my job. I want my job. My community needs me, but I'm scared. I'm scared because of what I've seen.
And when you think of your career, all the time in this hospital, these are your friends, these are your patients, this is your community. The thought that these may be your last days getting to do your job, what do you reflect on in your career and coming to this moment?
It's very difficult because I am very well respected in my community. I cannot tell you. And I haven't just been at the hospital. Before I had my kids, I always worked 2 and 3 jobs, and I worked in offices and urgent cares and different things. The community knows me. I love my community. I serve them well. And the fact that I'm not going to be able to do that devastates me.
it devastates me. Because when I leave, who's going to be their voice? Who's going to be these people's voice when they come in? Because they're going to come in with their vaccine injuries after I'm gone. And who's going to be their voice? They don't have one. And that is what devastates me, because they deserve a voice. They deserve to be heard. Many of them can't work anymore. They're on disability. They're dead. They got children. They got lives. Many of them don't have disability insurance, and they got hospital bills mounting. Well, they don't have a voice because they're being told they're crazy. You know, that is what devastates me the most. And, you know, again, I'll give up my career because, and many will. I got many on my side who are walking away from careers that they love because they're so scared. And that's the truth. And I have 4 particular patient families that I think about when I thought about coming on this show, because I talk to them on a regular basis, and I help them, you know, I help them. And that's what I'm supposed to do. That's the job I signed up for.
Well, I want to thank you for doing that job. I want to thank you for the courage it takes to express this, because it's not only your voice to all of those out there that are thinking of the vaccine, those that have been injured, but also those other nurses and doctors out there. I think you represent courage and what it means to do the right thing. And I hope that because of this show and this work and you're getting your story out there, that more people start reporting the virus so we can get a clearer